Yesterday, I was taking a photo carefully not to reveal who the patient was, and I could see the patient's feet poking out the bottom of the bed sheets. And it was a real stark reminder of what it's all about, really. There's real people being affected, it's not numbers.
These photos taken by Dr. John Williamson, an anaesthetist at the Whittington Hospital in North London. He's been given permission to document the pressures the hospital is under.
You can see infection rates are rising at incredible rates, so are admission rates, and then so are all the critically unwell patients. And if you've got the beginning of the phase, which is the people getting infected in the population, still rising, we know it's going to be transferred in a week or two.
From the Royal London Hospital in Whitechapel, an email sent from management said, "We are now in disaster mode. We are no longer providing high standard critical care because we cannot." While another doctor from another hospital who did not want to be identified told us,
"In the past 10 days, it has become relentless. We've nearly doubled capacity in our department, and yet despite that, yesterday we had 2-hour delays in ambulances being able to offload patients. We're short-staffed as they have to self-isolate or are falling ill themselves. We're seeing young, fit people coming through our doors. It has become dire. This is not normal. I've never seen anything like this, and I don't want to ever see it again."
And if the words aren't enough, these are the figures. The dark purple areas show where the rate of infection is highest across the UK. In England, 2,795 people were admitted to hospitals with COVID-19 on the 28th of December. That was 3 days ago. More than a quarter of those were in London. Essex and Buckinghamshire have both declared major incidents in the past few days. A monumental symbol of the first wave, London's Nightingale Hospital, and today it has been confirmed that instructions have gone out to reactivate it and to be ready to admit patients, although it is unlikely to be seriously ill COVID patients who need intensive care.
Brilliant, not even a flinch.
Then there is, of course, the vaccine, with the Oxford-AstraZeneca jab starting on Monday. But yesterday it was announced that with both this and the Pfizer vaccine, one shot would now be given, with a second injection up to 12 weeks later rather than the planned 3 weeks, meaning the cancellation of tens of thousands of appointments.
At such short notice, particularly over a New Year bank holiday weekend, to have to contact thousands of patients, particularly elderly, frail, vulnerable patients who may have been shielding for many, many months, to tell them that their vaccination has been postponed is really, really difficult for practices.
The government's advisory joint committee on vaccinations and immunisation said, however, this was the only way to immunise as many people as quickly as possible, and that one dose gives a high level of protection.
We really are in a situation where we have to get as many people vaccinated, protected against this disease as possible. And therefore, it's good news that the one dose is adequate enough to prevent severe disease. And so the absolute priority is to vaccinate as many people as quickly as we can with one dose, protect them against the disease, and then come back and do the second dose, which will allow the protection to be long-lasting.
Just over 944,000 people have so far been vaccinated, 2/3 of those aged 80 and over. But with the pressure on hospitals across the country now at critical levels, millions more will need that jab if there is any hope of life returning to some sort of normal.
Let's return to our top story and Dr. Katrina Pollock, who's a Senior Clinical Research Fellow at Imperial College London. There is a bit of concern about this idea of delaying the second dose of the vaccine. Has the government made the right decision on that or not, in your view?
So we heard earlier the very difficult decision that has to be made now with so many cases of COVID-19 coming into our hospitals. And this decision is based on expert advice about prioritising getting a first dose of vaccine into as many people as possible. And from an immune point of view, we know that both the Oxford-AstraZeneca and the Pfizer-BioNTech vaccines will give an immune response after the first dose. So from that perspective, it makes sense. I do understand people's anxiety, particularly if they're waiting for a second dose. Perhaps their second dose is going to be quite soon. But we also need to think of all those people who haven't had their first dose yet.
Pfizer and BioNTech, though, are saying that they don't have the evidence that the first dose alone will provide enough protection. Are you pretty confident that it will?
Yes, that's true, and the evidence is based on giving 2 doses for both the vaccines that have been authorised. So these are difficult decisions. We're in uncharted territory, and it's very important that everybody gets their second dose for that longer-term protection, and at the same time minimises the risk of infection, as we were hearing from Professor Montgomery earlier.
And, you know, we've got fewer doses of the Oxford vaccine available than we thought we were going to get right now, 530,000 versus 4 million promised. Is there a problem here with the packaging up of these doses, and how can that be resolved quickly?
Yes, the scaling up of vaccination is clearly a huge logistic challenge, and everybody is working very hard to do that. I think these challenges can be solved. I think we need to think that the point that we're actually at now, where we have 2 effective vaccines authorised for use in the UK, is a great start, but there's clearly still a lot of work to be done. And what I would urge all colleagues and patients to do is to be patient and to listen to advice about maintaining protection from infection and to get vaccinated as soon as they're offered.
Dr. Katrina Pollock, thanks very much, and sorry about the quality of the line.